Okay, so I'm going to be demonstrating my VE trigger. Have a bedpan, lubricant, pair of gloves, cup inflator, and air infuser, hemostats, my VE bag, 500 milliliters of water. So, and my towels. Just gonna make sure that this is clamped. Get my hemostats to So we put my 500 mLs of water in the bag. We shake this for 30 to 40 seconds. 30 seconds, 40 seconds later, we bleed this line. Make sure there's no air in it. At first, we pinch this ball out. Okay, so we're ready for a VE. Has already had a prep, which includes the dietary cleansing, and also laxatives and a suppository. And for if it's an inpatient, they would probably give them an enema. And for babies, they would heat up the barium a little bit. Hello, my name's Maria. I'm going to be doing your VE. Can I get your full name, please?
Bronson Masterchild.
And your date of birth?
5/7/41.
Okay. So I'm going to have you undress and put on your gown very quickly. And I'm going to have you come onto the table. I'm going to take a KUB on him.
Can you tie me? Just the bottom.
Okay. So I'm going to have you lie down facing up, please.
I'm not.
Is there any possibility you might be pregnant there?
No.
No? Okay. So I'm going to make sure that this is already detented and it is centered to the bucky. I'm using a 14 by. And I'm going to feel for his crest and center at the crest. Okay, make sure I put on a right marker. Okay, and then I'm going to shield as much as I can. Okay, if you put your hands on your side, please. Perfect. Okay, and then I already have a technique. So my technique will be an 80 kVp 32 mass, and we'll do it at expiration. Hold your breath, let it all out, and I take the image. What's the reason we're doing this VE on you?
I have really bad diarrhea.
We're going to be using high density barium. The doctor is going to tell me barium on. That's when I repeat back barium on and make it flow for the doctor, and then he'll indicate barium off. That means I need to clamp it with the hemostat, and that should be it. And so the doctor is going to fill up the the left collar flexure with barium, and then after that we'll drop the bag to the floor, and then the barium will be drained, and the doctor will take out the tip and make sure that first the air, of course, and then he'll take out the tip, make sure that we have enough towels for the patient, and then he'll be ready so we can do the open. Your left side. Go. And then I'm gonna have you bring this leg in a little bit more, and I'm gonna have him go a little more, about 35-40 degrees. There we go. Okay, so I'm going to have the lubricant. I'm going to put a little lubricant on there. And then we're going to have the BE bag about 24 inches from the table, off the table. Okay, and then I'm gonna go ahead and have you take a deep breath in.
Out. Out. Okay.
Okay, and then we insert the tip. It's gonna go up about an inch up to his umbilicus, and then we're gonna go horizontal, no more than 3.5 to 4 inches, and then the doctor's gonna come in and inflate the tip. Okay. We're gonna do the first image, which is 35 to 40 degrees caudal. Tented. Sure that I put a left marker. I'm sorry, to the as is. Make sure I column it. I shield as much as I can. Okay, so I'm going to go ahead and use 90 kVp at 25 to 30 mass, and that'll be for all my images. And now I'm going to do my regular PA. Make sure I'm still retention. Marker. Okay. I center at the crest. Make sure I show my patient as much as I can. Okay, and that's my PA image. Lie on his right side. So go ahead and bring that knee up a little bit. Bring your knee. There you go. And this is an RAO. I'm going to cover him as much as I can. I'm still centered with the bucky. I have a marker on there. Then I'm going to center at the crest. 2 inches lateral. And then, okay. So we're going to do this one at expiration. And then we're going to do the left side. So I'm going to have you turn to the other side. as I can. I'm going to do the same thing at the crest. Two inches lateral. Okay, and then that's my LAO. Now we're gonna do a right lateral. I'm sorry, left lateral. DQ. So I'm gonna have you lie on your left side. Go all the way onto your left side. And I'm gonna have you hold this with your hand right there. It's a little skinny. So good. Okay, so for this one, we're going to make sure that there's a little bit of light underneath him. And the center at the crest as well. Okay, make sure he's covered as much as possible. Okay, and that's my left lateral DQ. Now we're going to do the same thing for the right side. So I'm actually going to have you turn onto your back. Okay, and before we do that, we're going to do a left cross table lateral. Just let me go on this side. Okay, I'm going to put that there. Okay, so we're going to center at the crest as well. Okay. We're going to center at the as is for this one, for the lateral, cross table lateral, and then I'm going to have you roll onto your right side. Sorry. I'm going to center at the as is for this one. Make sure marker is there. Okay. And okay, so we're going to do the last film, which is the post-evac. I'm going to make sure that the bucky is centered. There's a marker. Center at the crest. And make sure it's 40 inches. That's it. Okay, so make sure you drink lots of water so that you get all the barium that you have in your colon.
Here's a KUB projection that we're using as a scout. This projection shows the size and shape of the liver. It also shows the spleen and the kidneys. It shows proper collimation. You can see that it also shows the pubic symphysis, and it goes up to the upper abdomen. Sometimes it's necessary to take 2 images to get the upper abdomen. So this is the scout for my BE. Here you have the PA axial. It best shows the rectosigmoid area of the colon. You can see the evidence of the proper collimation. The rectosigmoid is centered. You can see less superimposition of the rectosigmoid area than in the PA projection due to the 40-degree angulation caudal of the CR. You can also see the transverse colon in both the left and right colic flexure are always included in the image. This is the PA projection. It shows the entire colon with the patient prone. You can see evidence of proper collimation. The entire colon is included. The flexures and the rectum, the vertical column, is centered so that the ascending and descending portion of the colon are included in the image. Here is the left lateral D cube. You can see evidence of proper collimation, and you can see the area from the left colic flexure on the rectum. There's no rotation of the patient, as you can see by the evidence of the ribs and the pelvis. The left lateral D cube position shows the projection of the contrast-filled colon. This position best shows the side up of the intestine, large intestine. Here we have our cross table lateral. We want to make sure that we get the entire lateral side of the colon. The right lateral D cube, you can see proper collimation. You can see the right colic flexure on the rectum, and there's no rotation of the patient, as you can see by the evidence of the ribs and the pelvis. The right lateral D cube position shows the projection of the contrast-filled colon. This position best shows the side up of the large intestine. This is the LAO position. You can see the left colic flexure and the descending portion of this colon. You can see evidence of proper collimation, and you can see the entire colon. Left colic flexure is less superimposed compared with the PA projection, and also you can see the descending colon. This is the RAO position. You can see the right colic flexure and the ascending portion of the colon and the sigmoid portion of the colon. You can see evidence of proper collimation. You can also see the entire colon, and the right colic flexure is less superimposed or superimposed compared to the PA projection. And you can also see the ascending colon, the cecum, and the sigmoid colon. So this is my post-evac image of my BE. You need from the pubic symphysis up.